Hello, I'm Neetu, and today I'll be discussing the issue of access and affordability within the Australian early childhood education and care sector, highlighting its impact on equity, participation, and quality outcomes. So, the current issue: access and affordability in early childhood education. Access to and affordability of early childhood education must also be prioritized, or families will be unable to access quality education and care. Despite initiatives by governments to address the problem, many families lack adequate access to financial assistance and face long waiting lists, as well as inequitable access to services in rural and low socioeconomic areas. Making children's lives better directly impacts their developmental outcomes and puts additional burden on early childhood services and leaders. Effective leadership is essential in tackling access and affordability challenges. Drawing on transformational leadership theory, leaders are key proponents of equitable access and fostering inclusive service delivery. Transformational leaders create a compelling vision for educators and stakeholders that brings innovative solutions such as flexible service models and community partnership. It encourages collaborative decision making among educators and coordinators across strategies to improve access for diverse families. The strategies of effective leadership resonate with the development of positive workplace cultures that support collaboration, professional reflection, and ongoing improvement. However, despite these leadership approaches, tensions exist between maintaining service quality and ensuring affordability. In fact, research shows that increased regulatory requirement and operational costs can drive up fees for families while limiting access for those most in need. This is an important issue. Quality reform policies can also have the unintended consequence of diminishing access to care. This means leaders are challenged to critically consider how they can comply with the national quality framework whilst also being inclusive and equitable within their services. Access and affordability problems are also intimately tied to the Education Care Services National Law, which governs service quality and operation in Australia, and the Education and Care Service National Regulation. These frameworks may lead to textual compliance and safety, but also add to the financial and um, administrative burden on services. This is ultimately a leadership issue that requires us to critically examine the manner in which such legislation is enacted in practice, as well as law leaders can be adequate for policies within healthcare and academia that will better align with both quality and accessibility. A leader should think strategically and collaboratively to create a research informed plan of action to improve access and affordability, and that includes advocating for increased government funding and subsidies to reduce financial barriers for families, building community partnership with vulnerable and marginalized groups, offering flexible enrollment options to support different family needs, supporting inclusive policies that focus on equity and access, and supporting educators through professional development to ensure high quality practice is maintained despite resource constraints. Leaders who implement these strategies can ensure that their communities are more supportive and inclusive in accordance with legislative intent as well as principles of equity in early childhood education. In this end of year reflection, we cannot overlook how an equitable balance between teacher access and affordability is key to a productive workplace where educators are supported and the quest for improvement continues. The B section, which is the literature review. Access and affordability issues in early childhood education and care. were raised repeatedly across the academic literature and government policy documents. The sources below within some of the central themes and tensions in the sector. Beatson, 2022, The Barriers to Participation. According to Beatson, these barriers originate from cost, service availability, and family circumstances, making it difficult for families to consistently partake in ECEC. The research also note that even when subsidies exist, these do not fully meet the affordability concerns for all families. And this implies that just providing financial support isn't enough. So leaders must also be aware of wider structural and social barriers when developing inclusive services. Then Tang in 2024, which talks about the limits of subsidy systems. Tang examines income based childcare subsidies and contends that such systems have a propensity to reproduce inequality as lower income families continue to be burdened with out of pocket costs. This strengthens the idea that present policy frameworks, even if they are supportive in theory, might not bring about equitable outcome in practice, and leaders need to push for reform. The third one, Productivity Commission 2024, which is about policy reform. The report from the Productivity Commission in 2024 highlights that there are challenges for an ECEC system in Australia related to its affordability, accessibility, and inclusion, while suggesting there is a substantial need for reform. It has revealed systemic inefficiencies and provision gaps. That makes access and affordability not just a service level issue, but rather a national policy challenge that requires leadership that advocates beyond the service level. Australian Institute of Family Subsidy in 2023, financial pressure on families. Many families are still spending a large percentage of their income on childcare. Financial constraints remain a significant reason for less participation. This really highlights that there is a disconnect between policy intention and lived experience, which exposes the need for leaders to critically reflect on affordability as an obstacle for enrollment and inclusion in their services. Michelle Institute 2022. According to the Michelle Institute 2022, more than 1 million Australians are living in areas with restricted or no access to childcare services, with the problem especially acute in rural and disadvantaged communities. This problem adds to the challenge of geographic inequity, forcing leaders to implement new and flexible service delivery models that will allow access gaps to the addressed. And the last one, OECD in 2025, which talks about social outcomes and equity. Quality early childhood education and care is considered important to mitigate social inequalities and link children with better educational trajectories in the long run. It reinforces the broader societal significance of the issue and might scare some leaders into realizing just how important their practices and decisions are for social equity. Critical reflection. Together, these sources um, illustrate that access and affordability are shaped by interrelated elements, including cost, policy design, and geographic availability. Despite government efforts such as subsidies to boost participation, inequalities in the data persist across studies. From a leadership standpoint, there necessitates critical reflection on how such policies are translated into practice. Leaders need to transcend compliance and play advocacy roles, collaborate with us as we challenge systemic inequalities. This is central to the National Quality Framework values for continuous improvement, inclusive practice, and responsive leadership. Critical reflection. um, Description of the issue in the Australian context. Access and affordability remain major issues in the Australian early childhood education and care sector. Despite government initiatives such as childcare subsidy, which aim to reduce these barriers, many families face financial barriers or limited service availability and inequitable access, particularly in rural and low socioeconomic communities. These challenges affect children's enrollment in early childhood, which is foundational for developmental milestone and school readiness. This is not just a service provision issue. From a leadership perspective, this touches on issues of equity, inclusion, and social justice as well. Leaders have a responsibility to balance financial sustainability with the delivery of high quality, inclusive education services within often regulatory and economic restrictions. This raises tension between quality standard and accessibility of services to all the families. The risk in relation to EYLF and NQS. When we apply the aspect of EYLF and national quality standard, there are few risks surrounding access and affordability. To begin, the EYLF underlines beliefs of equity, inclusion, and high expectation of all children. Barriers to accessing decent quality, affordable ECEC service result in vulnerable and disadvantaged people being excluded, jeopardizing these principles. If children are unable to attend or participate consistently, these opportunities to attain key learning outcome like a strong sense of identity and well-being are highly compromised. A number of the quality areas will be affected, which is quality area 1, quality area 6 and 7. Disruptive continuity of learning and resulting limits to effective implementation by educators are where attendance is inconsistent due to affordability issues. For quality area 6, financial distress also may limit family interaction, as families in distress may feel peripheral to the service or unable to fully participate. And quality area 7, however, leaders are under increasingly pressure to comply with regulation whilst keeping the operational costs down, which include compromised decision making and workplace culture. Some of the strategies that we can use to reduce these risks, and the first one is advocacy for policy reform and funding. Evidence show that current subsidy models do not adequately address affordability. This is an example of transformational leadership where leaders intentionally inspire others to drive change beyond their own context. Then flexibility and inclusivity in the service model. The literature emphasizes access challenges in disadvantaged locations. Leaders can implement flexible enrollment option, offer part-time or occasional care, look into outreach or mobile services in low access communities. And this is available for all children, displaying the principle of equity and inclusion of the EYLF. Strengthening family partnerships. Leaders could create supportive, non-judgmental environment, subsidy support services information, engage families in decision-making process, and all this directly aligns with quality area 6. Becoming distributed leadership and professional collaboration. Here, leaders can share leadership responsibilities among educators, encourage collaboration, problem solving, foster reflective practice within the teams, and this is consistent with positive workplace cultures and enhances service responsiveness. Maintaining quality while managing cost. Here, the leaders must focus on the quality rather than the hyper compliance, evaluate how the resources are being allocated using reflective practice, and support the educators through professional development. So this analysis emphasized that access and affordability are systemic issues embedded in leadership practice, interpretation of policy, and educational outcome. Legislation such as the EVALF and NQS support high quality, inclusive practice but is limited if children cannot access the service. To be a leader in the future is to shape critical and reflective mindset above such compliance. This means pushing for change at the system level, encouraging an inclusive workplace culture, and creating new ways of thinking that promote equitable access. As the adage goes, the future is already here. It just hasn't been evenly distributed yet. Thank you.